Let's bring in our next guest to the show, and that's our good friend, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. How you doing this beautiful morning?
I'm doing okay, working hard here, keeping everyone updated on what's going on and what isn't going on.
Yeah.
Hey, what do you have for us in the world of sports medicine?
You know, I mean, what a lot of people are talking about in sports medicine, and, you know, it's been a long time of us talking about this, maybe ever, is people are a little puzzled about the LaMarcus Aldridge situation. So this very key piece for the San Antonio Spurs, as you know, in the NBA, there's been a lot of these stars going down in these big games and not able to play. His is a little unusual because he has an abnormal heart rhythm, an arrhythmia, right? You've heard about that?
Yeah.
And they said that he's getting a workup and is out indefinitely. And as of looking up a lot of things yesterday and right up till now, they're not saying exactly what heart rhythm it is, but he's had this in the past. I think are you aware of that?
Yeah.
Yeah. So in 2007, in his rookie year, he had a condition called Wolff Parkinson White, WPW it's called. And it is... he had it again in 2011, and this is an abnormal heart rhythm that makes the heart beat really fast. And so athletes or people that have WPW, they feel dizzy, they may feel a fluttering or funny heart palpitations because their heart's pounding so fast, they might be short of breath, they might feel like they're going to faint and feel very anxious when they get WPW, this really rapid heart rhythm. And of all the things we look at that can cause sudden death that we have to watch in athletes, this isn't one that's the highest on the list of causing sudden death. Most of the time, it's just these symptoms and the heart beats fast, but there are a couple of rare instances where it can be life-threatening. What it is there's an extra pathway in the heart, an extra electrical chamber, and it starts having the heart beat to two different impulses. And so there can be an extra pathway between the upper chambers and the lower chambers of the heart. And a very great procedure about a couple decades ago, there's a treatment for this. It's called an ablation treatment. And in fact, LaMarcus Aldridge twice in his career has had ablation, Ray. And this was a great advance, as you know, the technology in medicine, in cardiology, where they can go in through a catheter, find where this extra electrical pathway that's triggering the heart to beat too fast, and they can get rid of it, ablate it by either heat or by heating it or freezing it. And in fact, at Akron Children's in the last 20 years, we have one of the nation's experts, John Clark. I actually spoke with him about this last night. He does these ablations for kids, and he's saved the lives of hundreds of kids, hundreds of thousands of kids in the last several years at children's and at children's hospitals around the country. Thousands of kids' lives have been saved by these ablation procedures. You get rid of it. Now, most of the time you get rid of it and it doesn't come back. Aldridge had it come back in 2011. They're not saying if that's what's come back in 2017. They're really just saying, you know, abnormal heart rhythm, further workup, and out indefinitely. But he may be having another one of these abnormal heart rhythms that needs to have the catheter ablation therapy. And these are rare, Ray, but they do occur sometimes. You know that you and I do some volunteer coaching on the side. One year I was coaching a kid in basketball, and he came over to the sidelines, and he gave me a real funny look. He said, "I feel like I'm going to pass out," and I didn't have my stethoscope handy, but I felt his heart. It was beating very fast. And in fact, I had to send this kid to cardiology because of these abnormally fast heartbeats like Wolff Parkinson White, WPW, that LaMarcus Aldridge has.
Okay. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Joe, can I ask you a question about Kipnis here? When I was out in Arizona a couple of weeks ago, the day I got there, they said discomfort in the shoulder. They said a rotator cuff strain. They gave him a cortisone shot. They said 4 to 5 days, he'll be okay, should be able to start throwing. He DH'd a couple of times. Now they're saying we're going to shut him down for a couple of weeks and go from there. And I'm no doctor. That's why I'm asking you. That's concerning to me. Is it to you or not?
Yes, it's concerning to me that he didn't respond to the initial injection. We have to give, what's the biggest probability? And in a lot of these cases, a condition where people in the overhead position, like throwing a baseball or lifting weights overhead, they will get a pinching, and we call it impingement, on this rotator cuff and the bursal sac, and it is a kind of thing. They gave you the highest probability. You inject it, you put them on a physical therapy regimen, you stay out of the overhead throwing position for a couple of weeks, and the shoulder responds very nicely, and they go back to activity and do well. And the flip side is you do all those things for 2 or 3 weeks, they go back to throwing, they go back to hitting, they go back to lifting weights, whatever overhead activities they're doing, and they are still having symptoms, and now you get the sense there's a chance it could be something more structural than just this inflammatory pinching known as impingement syndrome. So yes, I'm reading right along with you, Ray, and as I saw that he didn't respond to the initial treatment, now we're looking at longer rest. I'm sure we're looking at other possibilities treatment-wise, but the next set of things we do, the next stage down the road, is a longer one, and it sure sounds to me like there's a possibility if Kip is not responding, he may miss the beginning of the season.
Okay, and then Carlos Carrasco goes for an examination yesterday, and they said some slight swelling in the elbow. And I don't know what that means. Is that a concern, or is that a natural thing that a pitcher gets?
It was so interesting as I listened to what, the old motto, in Tito we trust. I listened to a few of his press conferences out there, and as they say, in the spring, he says the majority of people feel a little bit of soreness in the shoulder or the elbow, and they may get a little bit of inflammation with it. Considering Carrasco's history and other things, I think the fact that he still has some inflammation in week 3 or 4, it's a little bit concerning. Now, what I didn't hear was in somebody like Cody Anderson, they've actually already looked. He had a surgery. He has some reasons for having that inflammation, and they even went so far as to say some inflammation around the ligament. I haven't heard that about Carlos Carrasco yet, but anytime you're talking about a pitcher and 3 weeks into camp or so, and he's having swelling around the elbow, you're going to be real careful with it, and it's concerning. And again, the difference is just inflammation, or is there something structural like a stretch or a tear to that ligament on the elbow that's giving him the inflammation? And then we're more concerned again. So I'm right along with you, concerned about any of these things that come up in our guys, but they're very common in baseball. It's part of the territory, and we'll just have to see if we go into this season, the Cleveland Indians, with a couple of banged up players.
Great stuff, Joe. As always, thanks for making time, my friend. We'll catch up with you next week.
Have a great week, Ray.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.